Many experts are warning that lifting the lockdown could lead to a second wave of COVID-19 cases in the fall or earlier. We're here to take your questions. Dr. Christopher Labos is with us, epidemiologist and cardiologist in Montreal, and the host of a medical podcast called The Body of Evidence. It's good to see you, Dr. Labos. Thank you for coming back.
My pleasure. Thank you for having me.
We have not had a medical expert for a little while covering other news, and we haven't seen you for a couple of weeks. So as we begin this morning, why don't I just touch base? What have you been seeing since our last meeting, good and bad?
Well, I think good what we're seeing is that the number of cases across the country is starting to slow down. You're having a few provinces reporting 0 cases on some days, so things are easing up. There's still a little bit... It's still a little bit difficult in Quebec and Ontario, where you see the number of cases still coming in, although even that has plateaued out a little bit. The number of cases is not growing on a daily basis, which is what worries us. So overall, I think we're seeing encouraging signs that we're getting into a situation that is more or less okay, and hopefully, at least here in central Canada, we're going to start to see cases decline soon. So some reasons for cautious optimism, I would say.
And those are the reasons and the encouraging signs that are leading more and more people to talk more openly about reopening the economy. From a public health standpoint, what are the keys to doing that?
I think the keys to reopening the economy and having people go out in public again are really a couple of things. One, you want to make sure that you have an adequate testing and screening program in place so that you can isolate new cases as they come up. Because there will be reinfections, right? The minute you have people recirculating and going back to work and interacting, you're going to have transmission of the virus. But if you can identify these cases early, prevent the spread from becoming exponential the way it was near the beginning of this epidemic, you can contain the virus perhaps a little bit more easily. So if we have a good screening program in place, that's going to be key.
But can I just jump in, though, because that's been one of the areas where that's been the biggest cause of concern, because the numbers have gone up, but the consensus seems to be it's nowhere where it needs to be in order to allow for a big reopening. Is that a concern for you?
Yeah, it certainly is. I think it's a concern for many people. You want to make sure that you can test everybody you want to test, and we're still not quite at that situation. And the situation differs from province to province, but, you know, a lot of people are being told if you have a mild disease, you don't need to get tested right now, and that may be valid for the current situation. But if we're in a situation where we're reopening the economy and people are out there interacting, you want to be able to quickly identify people who should be staying home. Now, that being said, if you have the capacity to stay home, maybe continue to do so anyway. And I think that's the other big key, is that just because the economy reopens doesn't mean you have to return to work, doesn't mean you have to return to your previous lifestyle, your previous habits. So if you're an at-risk person and you're concerned about the virus, the other thing is going to be maybe continue to stay home, even if the government does lift certain restrictions.
A question in from Kevin already, and I recall we spoke about this very issue last time you were in with us, Dr. Labos, but he's wondering, Kevin, why don't we conduct the blood test for COVID-19 antibodies, those serological tests that we were talking about? And Kevin goes on, those who have the antibodies could go back to work if they have the immunity to restart the economy and help protect those who are still at risk. Where does that type of testing stand?
So I think that's ultimately going to be quite key, because a lot of people who got the infection were never actually diagnosed properly. They were never tested. So you're going to want these types of antibody tests to know who actually got the infection in the past. You want to see who has antibodies to this, so you can find out who's immune and maybe is going to be protected from future infections. Now, the caveat to that is we're not absolutely 100% certain that the presence of antibodies means you're going to be immune in the future. It's a reasonable assumption, but it hasn't actually been proven yet. The other problem is we still don't have any approved antibody tests here in Canada, and that's because I think there is some concern that we want to make sure that these tests are accurate. What happened in the US is they've run into a bit of a problem, is that previously the FDA wasn't approving any of these antibody tests. Then under some degree of pressure, they allowed some tests to be put onto the market with the caveat that they had never been validated. And that led to a problem now, is that a lot of people are testing with these new antibody kits from various companies that have uncertain diagnostic accuracy. So you get a result and you're not sure if it's true or not. So, you know, a bad test is worse than no test. So I suspect that is going to be coming. When Health Canada will actually grant approval to these things remain to be seen. But testing people to find out who's who has antibodies is probably going to be key to this whole process as well.
One of the phrases that we're hearing an awful lot these days, Dr. Labos, is herd mentality. Can you, sorry, not herd mentality, herd immunity. Can you explain what that is simply, and then how it applies to the COVID-19 situation?
Yeah, so herd immunity is the concept that when enough people in a population are immune, it protects the people who aren't immune. So if you think about it, a virus has to spread from person to person in order to survive. But if you get sick, but everybody around you is immune, there's nowhere for the virus to spread, and the virus essentially dies out. So once immunity levels in a population reach 60, 70, 80, 90%, once there's enough immune people out there, the virus stops spreading. So the idea is that if enough people eventually become immune, either through a vaccine, if one comes out soon, or because they've gotten the infection and are immune, if that happens to enough people, eventually this virus will start to peter out. But the problem with that, sorry, go ahead.
No, I was going to say that's the theory, but not everyone's saying or believing that it applies as far as COVID-19, and I'm wondering why that is.
Yeah, so there's a couple of issues. One is we don't know if immunity is going to be long-lasting with COVID-19. We're assuming it is, but we don't actually know. Remember, no one's experience with the virus is more than 4 or 5 months old at this point. So we don't know if you got the infection now, if you'll still be immune in the fall or a year from now. We're assuming you should be based on how other viruses behave, but we're not absolutely certain. So that's the first problem. But the other problem is that for herd immunity to work in the absence of a vaccine, you basically have to have everybody in the population get infected. And that's going to translate into a lot of deaths. And that might be a human cost that's a bit high to pay for most people. So herd immunity is an interesting idea in theory, and it certainly works when you have a wide-scale vaccination program. But just exposing people to the virus, even if the fatality rate is very low, if you have a lot of people infected, that does translate into a lot of deaths. And that might not be something that we're prepared to accept as a society.
A concern for many that is attached to reopening is if reopening comes too quickly without the proper testing and tracing in place, if it goes too fast and prematurely, second wave is the big danger. And I wonder if you could speak to second wave and what it is. Why is the second wave considered even more dangerous than this first experience?
I think there's a couple of reasons why we have to be careful. One is, of course, if we get lulled into a false sense of security, people might start doing things that are somewhat imprudent in terms of not respecting proper social distancing. So you might have a resurgence of cases, and you might have the exponential, explosive growth that we were so afraid of the first time around. The other thing that we have to be worried about is that if we have a second wave in the fall, excuse me, that might actually coincide with flu season. So now you have 2 infectious diseases that are circulating and landing people in hospital. And that might overwhelm the health system too. So that's something that people are particularly worried about. So when we're talking about how things are going to play out in the fall, there's a number of reasons to be optimistic. Hopefully by the fall, we're going to have at least some treatment for the virus available. There's a number of medications that are under investigation. So hopefully we'll have some treatment available yet, even if we don't have a vaccine. But the flip side to that is that we have to be worried about catching the flu. So while we don't have a vaccine against COVID-19, we do have a vaccine against the flu virus. And so making sure people are vaccinated come fall, that's sort of going to be key in making sure we don't have the healthcare system be overwhelmed, because now we have 2 things that might be, we have two potential viruses that might be causing epidemics in the fall and winter months.
Getting people vaccinated, but also, I suppose, for scientists, getting the right vaccine for the right flu strain, that's going to be even more important this fall, isn't it? Because if they miss, as they have, I mean, it happens, it could be pretty disastrous if we don't have the protection we need for the regular flu.
Yeah, that's right. Unfortunately, the flu strain that circulates changes every year. So the vaccine that you get is usually 3 or, in our cases, 4. It's a vaccine against the 4 most common flu strains that have been circulating in certain parts of the world. But it is essentially a guess. It is a prediction. And sometimes people guess right, and sometimes people guess wrong.
Yes.
Now, of course, the hope is that we want to have a good flu vaccine because we don't want to have that second whammy when we're talking about, a potential second wave in the fall of COVID-19.
Exactly. Question from Margot, since we're talking about all of this. Margot wonders, given that we still do not have a vaccine, nor testing for everyone who wants it, we spoke about that last hour, Dr. Labos, what has changed in the last month that would trigger even a staged opening of businesses? Won't some people still get sick?
Yeah, listen, the unfortunate reality is that when we have a reopening, you probably will see an increase in some cases. What has changed is that, number one, you haven't seen the system become overwhelmed. So you haven't seen the system bursting to capacity like you saw in Italy and like you've seen in New York. So there is some feeling on the part of the government that this is containable. The other reality is just practicality. The government is assuming that people will not be able to maintain this degree of social isolation for an extended period of time, and that you're going to have to reopen at some point. So better to do it in a controlled and gradual manner where you still have some ability to adjust and course correct if things start to go wrong. So nobody really knows what the correct course of action here is. I think most people and most governments, at least here in Canada, are looking at it and saying, okay, once we see the number of cases going down, let's start slowly, let's take baby steps, let's see what works, let's see what doesn't, and let's try to get into some sort of equilibrium. But you're right, we probably do have to prepare ourselves for the fact that there might be small increases in cases as we go forward.
And a question as well this hour from Gerald, wondering if you could give some more information about what more Canada needs to do for testing and tracing. As he says, this seems to be so important in other countries. What are your thoughts on that?
I think the most important thing is really just going to be to increase our capacity, make sure we have more testing kits, make sure we actually have the personnel to get the tests done quickly. We need to see, as the technology evolves, can we invest in rapid response kits so where we get the results quicker, so that we can get the results within the same day rather than having to wait a couple of days to actually get the answer. And the other thing is going to be, do we start implicating antibody testing? Do we start doing these blood tests to look for antibodies to get a better idea of who is actually infected and who is actually immune? That's going to allow us to have a much better understanding of, first off, how many people were infected and who might actually be immune. The great irony, if you will, is that we see the number of cases going up and up and up, but they're probably an underestimate because a lot of people probably got this virus and either never knew it or were, symptoms they had, their symptoms were so mild that they never got around to being tested.
One other point to add to that, I mean, we're just hearing about Australia. One of the things that Australia is doing is bringing in a wide, for more than 1 million Australians so far, they've downloaded an app, literally an app, which is for contact tracing. So anyone who's using it and downloads it will find out very quickly if they've made contact with another user who has tested positive. So technology and apps perhaps in this way also increasingly important in Canada as we look to the future, Dr. Labos.
Oh yeah, absolutely. And I mean, part of the problem too is if you only find, let's say it takes 2 days to get a test result back to find out that you were COVID positive, you now have to retrace all your contacts over the past 2 days and think about where you went and what you did. And that can be hard to do because we forget when we went to the grocery store, when we went to the hardware store, when we had to go pick up this from some person. So an app like that that's going to allow you to retrace your steps is going to make it much easier to then subsequently test all the people that you came into contact with. So, all these things are going to be key. It's a very complex process, but there are things that we can do to minimize the risk. And we're really going to have to learn to embrace technology a little bit to make our life a little bit better.
Why don't we pick up on that case out of Toronto Sick Kids Hospital? We are talking about reopening and some particular questions for that too. But on the sick kids story, Dr. Labos, what I'm wondering, this is day 47 of the pandemic. We're now talking, that's, in kids, how we're seeing it in children, how it's presenting in children. And I'm wondering, I have some specific questions in just a second, but what would you say is fair to assess our evolving understanding of this disease? We used to just think it was a respiratory condition. You're a cardiologist, we know what it's doing to the brain and the heart. How would you say where we are in terms of how we view COVID-19 now?
I think as we gain more experience with the virus, we appreciated that there can be, quite a few patients that have atypical symptoms. At its core, it's still a respiratory virus. So most people are going to have the most common symptoms, which are fever, cough, shortness of breath. But you are going to see some people have these atypical type symptoms. So loss of sense of smell was something that came up in a few of the surveys that were done. There's, a certain number of people that have diarrhea, nausea, and vomiting, so gastrointestinal symptoms. So these are not, strictly speaking, that unusual. A lot of viruses can have these systemic, non-specific type symptoms. But we are sort of, I think, realizing that a lot of people have not quite the typical symptoms that you would expect. And the other big thing is that a lot of people either have very, very mild symptoms or no symptoms at all. And on the one hand, that's a good thing because it means that, most people are going to be okay. And so we want to take an optimistic view of this. But the unfortunate reality is that because most people don't have symptoms or have these very mild symptoms that most people would just write off, it means that it's much easier for the virus to spread. And part of the reason why it was so hard for us to contain this virus is because a lot of people are probably asymptomatic carriers, and it makes it very hard to pick these people out and to identify them unless you have a widespread testing strategy in place.
Which we've been talking about this morning. So that is the case, the unusual symptoms and, let's say, a milder presentation of the disease. What's been interesting, as we've seen more and more reporting done, is when it is in its most serious form, it really seems to attack every major organ system. And we're hearing now of young people, middle-aged people, 30s and 40s, dying of strokes because of, or they believe, brought on by COVID-19. Now, what's the connection there?
So what seems to be happening, in most cases at least, is that when you get very, very sick, and this is actually not specific to COVID-19, you can see this with any type of very severe illness, but your body can actually develop something called DIC, diffuse intravascular coagulation. And it basically means that the blood clotting system becomes dysfunctional. So you can either have excess bleeding or you can have blood clots. And so the theory is, or at least one of the theories, is that what this infection is doing is it's attacking multiple organ systems by causing these types of blood clots. So it can cause blood clots that are going to lead to strokes. It can either cause blockages in the heart or directly affect the heart muscle. And it can also affect the kidneys. And so it can cause multiple other problems. And that's what's rather unfortunate about this virus. Most people are going to be okay and have very, very mild symptoms. But a substantial minority of people are actually going to get very, very sick. And there's no real good way to predict who is going to get what. As a general rule, the older you are and the more risk factors you have, the more likely you are to have a severe disease. But it's not a perfect prediction. And you're seeing a lot of otherwise young, healthy people getting very sick. And that probably has more to do with genetics than anything else.
Yes. A couple of viewer questions for you, Dr. Labos. From Kathy, and you mentioned this. You mentioned summarily looking at the heart, but she was wondering specifically, what are you seeing as far as COVID-19 affects the heart?
Yeah, so COVID-19 can affect the heart in a couple of ways. One is any infection can just put stress on the heart. So if you have pre-existing heart disease, because you're putting more demand on the heart and making it work harder, you can cause strain and muscle damage and essentially a heart attack. The other thing that can happen is that there does seem to be some suggestion that the virus can attack and weaken the heart muscle, causing something that we call cardiomyopathy. So that's been described. It's not very, very common, but it does happen. So we do have to remember that people are going to develop other medical problems during this pandemic. There were some reports about people not going to the hospital because they were afraid of getting sick. And that's, completely understandable and fair enough. But we have to be mindful of the fact that people still get sick. People are still going to develop heart disease. People are still going to develop cancer. And so we can't neglect all the other stuff that's going on. And sort of moving forward, one of the aspects of opening up the economy again is really opening up the medical system again so people can keep getting their medical care and that we can still keep treating all this other stuff that are still making people sick.
Yeah, one would anticipate a big backlog in procedures and operations given the fact that so much of that more elective work has been put on hold to focus on COVID-19. Last question this time round, Dr. Labos, from Maya in Quebec, as you are, and we're talking today about how Premier François Legault is supposed to be announcing his plan for returning to school, this phased in, this progressive response within the province. She'd like to know your opinion. She has a 6-year-old asthmatic son, and she wonders, speaking of reopening, going back to school when those classes do reopen, if it's voluntary to go back, should she exercise caution and wait a little longer before sending her 6-year-old asthmatic son back to class?
Yeah, if I was in that situation, I probably would as well. This is going to be a voluntary reopening. So if your child has medical issues, particularly respiratory issues, I would wait. I would continue to keep them at home until things settle down a bit. It's also unclear what this voluntary reopening is going to mean in Quebec. It might just be in the regions and not on the island of Montreal. So we'll have to see what the actual details are. But that's the thing, it is going to be voluntary. So if there's any doubt in your mind and you have the capacity to keep your children home, you can certainly keep doing that and exercise, as they say, an abundance of caution.